The World Health Organization estimates that in the year 2018, there were 228 million cases of malaria in 89 countries with 405,000 resulting deaths. According to the Global Malaria Elimination Classification, Ghana and much of West African countries are currently classified among nations considered to be in the control phase. Every year, around 2,000 people die from malaria in Ghana. About half of these deaths are of children under the age of 5. In the Techiman Municipality, however, malaria continued to be the #1 cause of ill health within the municipality. Mr. Dabuo Miel is the municipal malaria focal person.
Malaria is still on the ascendancy, though we have other diseases that is moving fast, just like malaria. Malaria in the municipality still continue to be the leading morbidity cases that we are recording in our facilities.
Despite the high levels of coverage in the distribution of insecticide-treated bed nets and other preventive interventions, the level of malaria morbidity in the Techiman Municipality remains relatively high. This, according to Mr. Dabuo, is because people do not use these nets, most of which are distributed freely by health authorities.
It's still on the high, but why is it still on the high? It is the human behavior towards the usage of these interventional provisions given to them. We have distributed a whole lot of nets, and it's still continuing. Every day a mother goes to the facility with pregnancy and is given a net. But let's ask ourselves, do these nets put in use? The people are not patronizing the usage of the mosquito net. That would have gone a long way in bringing malaria down drastically.
As the world marked the World Malaria Day in an era of the novel COVID-19 pandemic, Mr. Dabuo Miel calls on residents to continuously sleep under treated insecticide bed nets as well as improve sanitary conditions within their vicinities.
Malaria is real and it is fast increasing day in and day out. We are all crying and running helter-skelter about COVID-19, but malaria is there. Other diseases are there, but in terms of malaria, I would advise that every single person, be you adult or a child, sleep under mosquito net to prevent yourself from mosquitoes bites. That will give you malaria. I will also advise communities and everybody to try to keep to the sanitation and hygiene issues around us. Let's clean our environment around us. Let's try to tidy up all waste containers, ties, and whatever that is we think can contain or can hold water for mosquitoes to breed. Let's clear them off our vicinities.
Reporting for Joy News, Anas Sabit, Techiman.